Good afternoon, and thank you very much for joining us today. My name is Lee Constantine. I'm chairman of the Seminole County Commission. And today we're going to share with you some information about the CARES Act grants, the current status of COVID cases in our community, and the vaccination preparedness. With us today is from the Florida Department of Health, Seminole County Health official Donna Walsh, Seminole County Fire Chief Otto Draws, and also Janelle Dunn, CEO of True Health, the county's partner in serving under and uninsured population. We want to hear from these folks in just a minute. But the CARES Act right now, and I just want to go over some of this numbers, Seminole County recognizes the financial need of the residents and businesses. Originally, $59 million was approved by Seminole County CARES small business grants, and $7 million was approved for individual grant assistance. Other funds were exhausted. Our team had thousands of applications to review. As a result, the county designated additional dollars towards these grant programs. In total, the county has approved over $19.5 million to over 5,000 qualifying individuals, assistant applicants, more than doubling our initial investment. Eligible households were able to receive up to $5,000 in rental, mortgage, and utility assistance paid directly to their landlords, mortgage lenders, and utility providers. While the grant application portals remain suspended, individuals who did not apply for the opportunity at a later date can apply at a later date if additional federal funding is made available. In addition, CARES grants for individuals, $881,515 was provided to residents facing eviction. This was a coordinated effort with our judicial partners, the clerk of the court, and Seminole County Bar Association's legal aid. State SHIP funds were used for this effort to keep 340 clients in their homes. CARES grants were also back to the community by way of nonprofit grants. There were more qualifying nonprofit split. There were qualifying nonprofits split a share of $2.9 million as they continue to provide essential services for our community. Finally, CARES small business grants helped to keep over 2,600 businesses in operation during the pandemic. Nearly $13 million were allocated to qualifying businesses that demonstrated a loss. We have encouraged residents to patronize our small businesses, and we want them to continue to do so. As you support your neighbors through this event, or through this effort, you will be putting back money into our local economy, sustaining jobs, and supporting the same businesses that give back to our community. Also, locally purchased gifts available in our shops will be in your hands by Christmas. And we have a listing of businesses taking extra precautions to provide a safe shopping environment. As you frequent these businesses, we cannot stress enough the importance of safety. Seminole County's executive order for social distancing and mask use remains in effect. While fines and penalties are suspended for individuals, per the state, fines and penalties may still be assessed to businesses who have shown gross negligence. The county is seeking voluntary compliance without assurance or without issuance of fines or reporting to a business's respective licensing agency. There's a lot of news about the vaccinations. Seminole County is working with the state to prepare for the dissemination of vaccinations based on the priority list set by the state. The Department of Health, Florida's Department of Health, Seminole County officer Donna Walsh is here to tell us more. Donna?
Thank you, Chairman, and good afternoon. As you all have probably heard, we've had some exciting new developments that have occurred just within the last couple of weeks in the United States as well as globally, and I'll talk to those new developments in just a moment. But first, I do want to essentially give you a state of where we are in Seminole County and the state of Florida regarding COVID-19 cases and how we are seeing an increase in the number of cases. If you look at it globally, there's been over 77 million cases of COVID-19 reported since the beginning of this response back in February, March of this year. In the United States, almost 18 million cases. And here in Florida, 1.2 million cases with over 20,000 deaths. In Seminole County, so far we've had a total of 16,358 confirmed cases of COVID-19. Since the start of this response, we have 1,874 current active cases of COVID-19. We are seeing, as I mentioned several weeks, we have seen a steady increase in the number of cases. I often refer back to a moment in time where we saw a surge of cases back in the summer, May, June, July time period, and we called that exponential growth then because we saw a spike in the curve of cases going up. In the last several weeks, we've seen steady growth here in our county, and I would say, that we are currently seeing exponential growth again, unfortunately. The numbers of cases since the holidays has risen sharply. If you look back at November 12th through the 18th, we had a total of 642 cases reported that week. If you look at December 13th through the 19th, we've had over 1,000 cases reported for that week. So you can see that we are definitely increasing. Our positivity rate has also gradually increased. We were holding under 5% positivity rate. These are the number of people who test positive out of the total number tested on any one given day. And currently, we are at 9.03% positivity rate for the week of December 13th, compared to the previous week at 8.14% and a two-week average of 8.58%. So you can see that there is a gradual growth there in numbers of cases. I cannot stress enough, and I know that everybody's experiencing COVID fatigue. We're isolated. We want to be around our loved ones, our family, our friends. But I cannot stress enough the importance of continuing to be vigilant and practicing those protective measures we've been talking about for months. And that's the use of your mask, hand washing, and social distancing. Even though we've had some very exciting new developments occur with the vaccine coming out, in fact, December 11th was when Pfizer vaccine was approved for emergency use authorization. And then just last week, we had another vaccine, Moderna, approved for emergency use authorization. This is going to help us in the fight against the spread of this disease. But there's simply not enough for everybody all at once. It's going to take some time to provide vaccine to all of our community. And in the meantime, we need to continue to use these protective measures to keep the virus from spreading. There are priority groups because there's a limited amount of vaccine. There are priority groups that have been set forth by the federal government, the Centers for Disease Control and Prevention, as well as our state. And our state has adopted pretty much the federal guidance. If we look at the numbers of people or the folks that are most vulnerable to the complications of this virus, I know we've talked about this before, but that is our aging population. Those who are 75 years of age and older make up about 6.8% of our total number of cases here in Seminole. However, 73% of our deaths. So if you look at the same, with our folks who are associated with our long-term care facilities, nursing homes, there's about 6.8% of the total number of cases associated with those, but they make up over 60% of our deaths. So by far, this is our most vulnerable population. Therefore, priority group 1A includes those in long-term care facilities, nursing homes, assisted living facilities, and independent living facilities. Along with group 1A is our hospital workers, our frontline workers who are caring for those individuals. So just a couple weeks ago, when Pfizer was released, the Pfizer vaccine, 5 hospitals within the state of Florida received that vaccine. We were fortunate enough to have one of those in Central Florida, Advent Health Orlando. And Advent Health has been a great partner with the other hospital systems and providing vaccine for the priority groups, even within their hospital systems, providing that direct care to COVID-positive patients. And so more vaccine will be coming out. Every week we're expected to receive additional vaccine from Pfizer and Moderna. In fact, the first 3 weeks in Florida, it was projected that we would receive upwards of 1.16 million, or I'm sorry, 1.16, yeah, that's correct, doses in total for the whole state. Now, those numbers are subject to change because, there's variability on where the vaccine is distributed. But we should be getting doses of vaccine weekly here in Florida as well as throughout the nation. We stand ready to support the vaccine efforts here in Seminole. Along with the county, the Florida Department of Health has been preparing for weeks, if not months, for the arrival of the vaccine. And so we are actually one of 8 counties that are in a pilot initiative to support CVS and Walgreens through a federal agreement. The federal agreement is with these particular pharmacies to go into our long-term care facilities and start vaccinating them. They have already started that in some counties. They will be starting that this week in our county. And so we stand ready with our teams to go into the facilities and also vaccinate in the event that they need that help. But that priority group 1A also includes our EMTs and paramedics. It also includes our health department staff. Any of our healthcare workers that are providing testing, treatment, and vaccination will be vaccinated initially so that we then can start vaccinating the others within that group. In the priority group 1B will be our law enforcement officers. That will include our 911 operators and other essential workers. And then in the priority group 1C will be those who are 65 years of age and older. We all know that those with underlying health conditions can also develop complications from this virus, so we will be looking at including all of those folks eventually. But a lot of this depends on the supply chain, essentially. How much vaccine inventory is available at any point in time, as well as the supplies that go along with that. Just this morning, the Florida Department of Health in Seminole County received the ancillary kit for the Moderna vaccine. And we're expected to receive 8,100 doses of Moderna vaccine this week. So we can immediately start vaccinating those folks in those priority groups that we mentioned. I know there's been some concern about, well, what kind of side effects would I have from a vaccine like this? It's new. Technically, it is, this particular vaccine has been developed with new technology, the messenger RNA technology, but this technology has been studied for 10 years plus. And so the side effects that we're seeing and what was expected include what you would normally experience from a vaccine. And that could be soreness at the site, redness. You could develop a fever, chills, headache. Those are pretty normal side effects. And what that means is when you have those symptoms, your immune system is working. So those are good things. In rare exceptions, they are reporting that some folks have had allergic reactions or anaphylaxis from the vaccine. Those are rare, but we are prepared to address any of those situations by having paramedics on our vaccine teams in the event that that does occur. So far, what we have heard from the United States and globally is that people are doing very well with the Pfizer vaccines. Now, Moderna vaccine, since it was just approved through the emergency use authorization last week, it didn't even get deployed until yesterday throughout the nation. So hence why we haven't received it yet. But we are expecting it, within the next couple of days. So our plans here, working very closely with our partners, as I mentioned, the paramedics, the EMTs will be accompanying the vaccination teams. We will also invite, or we have invited, our community partners that have been along our side throughout this whole event. And that includes True Health, who you'll be hearing from momentarily, and also includes Allied Health. And we've had a number of volunteer nurses from Seminole County Public Schools that have stepped up and said, please include us on your teams. So we are in the process of recruiting them to help us on these vaccination teams. We have a lot of help. And so we are very confident that we're going to be able to provide the vaccine as quickly as possible, but as safely and effective as possible as well. So we are receiving the Moderna vaccine initially here in Seminole County. As you may have heard us talk about, the Pfizer vaccine requires ultra-cold storage. We do have that capability because of the efforts of Alan Harris, emergency manager, and his team to prepare well. We have that capability. In fact, it's not just for the Florida Department of Health, it's an asset for the whole county. So we have been working with our hospital systems in the event that they need that storage to make sure they have it available. And so we are prepared to receive that particular vaccine if need be. The Moderna vaccine requires freezer storage, and we also have that capability as well. Both of those two vaccines are both messenger RNA vaccines. They have to be used within a 6-month period of time, so we really have a short shelf life. If you take the Pfizer vaccine out of the ultra-cold storage, you only have a limited number of days if it's in the refrigerator to use it. That's 5 days. Moderna, 7 days if you refrigerate it. And then once you remove it and it's at room temperature, you have hours to use it. So a lot of pre-planning, we're talking less than 6 hours that we need to vaccinate, or that vaccine will go to waste. So a lot of pre-planning to make sure that we don't waste any of this precious vaccine to protect our community. There are two other vaccines that are in the 3rd stage clinical trials, in which we're very hopeful will come out early next year. One is AstraZeneca, the other Johnson & Johnson. So with the more vaccines being manufactured, the more available they'll become, and the more people in our community will be able to vaccinate. It's projected by early next year, we're talking March, April timeframe, there'll be enough vaccine manufactured in order to offer it to everybody in the community. But we will continue to go with our priority groups, those folks who are most susceptible to complications from the virus and those caring for those individuals that have COVID, in order to make sure that we protect as many as possible. Our State Surgeon General just talked with us again this morning. Certainly this is a priority everywhere for us to make sure we have all protective measures available for our community. So we will continue to prepare. It's going to take, every day, Alan and I were just speaking, the emergency manager, things are fluid. This is a fluid process. What we may know today can change in half an hour, right? So, we ask that our community be patient. There's a lot of educational materials that are available. We will be starting to talk to our community members even more. We have been talking and sharing information already. And our healthcare workers, those who work in private practices and such, we've gotten some interest, of course, from them because they are caring for individuals who may have symptoms for COVID. So they want to know where would they be in the vaccination process, and they are in 1A. So we are planning for what they call pods, or points of dispensing, setting up a place for our healthcare workers by appointment to come, and we'll make sure that they get vaccinated in that first priority group as well. That includes our dentist. We've had questions from dentists too. Well, what about us? Well, you're a healthcare worker. So you would also be eligible and qualified to come for vaccines. So with that, I wish everybody a very happy holiday season. I know that this is challenging. I know it's been a difficult year, but I ask you to please hang in there, be vigilant, protect yourself as well as your loved ones, and we're going to get through this. With the vaccine coming, it's certainly going to be much better as far as protecting our community. That, I'll turn it over to Chief Droz from Seminole County Fire, and he'll talk to you a little bit more.
Good afternoon. In coordination with the Seminole County Emergency Management and Seminole County Health Department, the Seminole County Fire Department stands ready with its EMTs and paramedics to prepare for the vaccines that will soon arrive in Seminole County. Like everything we do in the fire department, we plan, train, and prepare to serve the Seminole County in whatever emergency or crisis our community faces. Our firefighter EMTs and paramedics are a critical part of the medical infrastructure within Seminole County, and as such, will work alongside the great nurses and other frontline healthcare workers as part of the strike teams that will be established to distribute the vaccine. In the coming days, paramedics and EMTs will receive in-service training specifically about the vaccine that Seminole County is receiving. After that, the vaccines will be administered to our personnel. It will be a 2-shot series with 28 days between shots. The natural question is, how many will get the vaccine? It is not mandatory, and I can't give exact numbers or percentages of who will choose to get the vaccine. However, we have submitted a list of needs to cover all critical personnel in this endeavor. As with the entire pandemic, things will change, and the numbers being vaccinated will increase. I can tell you the personnel on the strike teams will have to have the vaccine in order to administer the vaccine in the points of dispensing. I can also tell you that having gone through COVID and witnessing the impact to communities, families, and more specifically, the number of fire and EMS personnel that have succumbed to COVID, I will be first in line to get the vaccine if given the opportunity. Once the paramedics and EMTs receive the first dose, they will be ready to serve on the strike team and assist where needed. I know at this point there are many more questions than answers, but as this vaccine rolls out, it gives us hope. Hope for getting our families, our community, and our nation back to a state of normalcy. The one guarantee is that things will evolve and change, and we will be ready to adapt to that change. However, I am confident that we will meet the challenge and overcome any adversity as we move through this vaccination phase. Rest assured that in this endeavor, as with all others, the Seminole County Fire Department stands prepared to serve our community in its greatest time of need. So far this year, there's been over 110 firefighter and EMT workers that have lost their lives to COVID. With that, I'll turn it over to our partner, Janelle Dunn from True Health.
Good job.
Thank you, Chief Rose. I'm Janelle Dunn, CEO for True Health, a private not-for-profit federally qualified health center here in the Central Florida community. As an FQHC, True Health serves as a safety net medical provider, and we have 7 locations throughout Seminole and Orange counties. At the onset of the pandemic, True Health partnered with Seminole County officials, including Seminole County Emergency Management, as well as the Seminole County Health Department, to provide COVID-19 testing within communities that had transportation barriers, as well as in areas that were designated as hotspots due to the spike in positive cases. Orange County provided grant funding to ensure that uninsured and underinsured residents had access to testing. To date, True Health continues to provide drive-through COVID-19 testing daily outside at each of our 7 locations at no cost. True Health is vigorously preparing to receive, store, and provide the COVID-19 vaccine to essential healthcare workers, long-term care staff, long-term care residents, and others as designated in Phase 1 of the distribution model. Next Monday, our staff will receive training on the administration of the vaccine, and as we progress through the phases of the distribution model, we remain committed to participate on vaccination teams that will deploy services out into the community to enhance accessibility. Additionally, True Health will remain in close partnerships with local county leaders to ensure that our vulnerable populations, those persons who are uninsured, underinsured, low income, or undocumented, have access to receive the vaccine. To find any True Health location or learn more about our services, please call us at 407-322-8645 or visit our website at www.mytruehealth.org. Thank you.
I don't have to tell each and every one of you that this is just, I'm sorry, this has just dominated 2020. And with the bringing on of the vaccinations, there's hope. And as we all know, hope is probably the best thing. And so we've really got to make sure that we are doing everything we can as we start these vaccinations, not let our guards down, ensure that we're taking care of our loved ones. You know, people just, I think because it's not like a war, and you don't see the casualties per se, but over 300,000 of our fellow Americans have died from this. Died. Our most vulnerable. The greatest catastrophe this country has ever had was the Civil War. And 600,000 died in that. Think about that for a minute. We have got to take control of this. As Winston Churchill said, this is not the end. This is not even the beginning of the end. But with the vaccination, it's the end of the beginning. And we have now the opportunity to take control of this. What we need to do now is just make sure that we're vigilant and that we do everything we can in our homes and when we're out to take care of one another. I'm happy, and so is the rest of the folks here, to answer any questions. Does anybody have any questions? Yes, ma'am.
I have a question.
And it's real hard to see up here with the lights, so please.
No, I understand. I had a question for Ms. Donna Walsh.
Sure. Donna, why don't you come on up here?
You mentioned that pilot program. Can you better explain when that's going to start, the day this week, and which CVS locations will include it?
Well, the pilot initiative is not for folks to go to CVS or Walgreens to get the vaccine, but for CVS and Walgreens to send their teams into long-term care facilities. So Pinellas and Broward counties were the initial counties. And in fact, we learned this morning that with the National Guard and our incident management team from Tallahassee, they have completed vaccinating all long-term care facilities in Pinellas County already. So those were the two initial. The CVS and Walgreens, we here in Seminole asked to receive vaccine early, the 8,100 doses, so we could go into our long-term care facilities. We are pending CVS and Walgreens asking us for that support if needed. So we stand ready for that. So that's really the few counties involved in that, were so that we could more expeditiously go into those facilities.
But that's not happening yet.
No, we haven't received the vaccine yet. So,
That's the question I had, Don.
Yes.
I know that we said last week that we thought we were going to have vaccine maybe as early as tomorrow. Is that
Right.
still the timetable?
it is, but it's late tomorrow. So we're talking into the evening, right? And so, what we will do with that vaccine initially is to vaccinate our teams, our vaccination teams, EMTs, paramedics, and all those who will be on those teams once we receive it. And then we'll stand ready in the event that CVS and Walgreens ask for support to go into our facilities alongside them. But the number of doses we're receiving is not, as you can imagine, 8,100 is certainly not a large amount. So, we will continue to vaccinate those in priority group 1A, and then stand ready to support Walgreens and CVS if needed.
And I guess you don't have a crystal ball that's going to tell you. So you're hoping to get the first round tomorrow evening.
Right,
8,100 is the number,
right.
and you don't know when the next batch is coming down the pipe.
No, early information from our governor's office was that weekly the state of Florida would distribute vaccine as they receive it to the different health counties. We did learn this morning that all 67 county health departments or counties would be receiving vaccine by next week. So I don't have any more specifics other than that. But I can only imagine that we will continue to receive vaccine as it becomes available.
And that 8,100, is that the number of vaccines that you were promised, or is it less?
That number was determined based on the number of residents and staff in long-term care facilities and our first responders and vaccination teams. So that was an estimated number based on that priority group, or those priority groups. Yeah.
Is there enough to cover all those people?
It is, yes. And like I said, we will continue to vaccinate everyone in that Group 1A. In the event that Walgreens and CVS don't need our support, we will then go on to Group 1B. And that's our law enforcement workers, 9/11 operators, and essential workers.
And to be clear, that's dose number 1.
Correct. That's dose number 1.
And for Moderna, it's 28 days later for dose number 2.
That is correct, yes.
Donna, if you don't mind, just to make sure I understand this right. So what I think I just heard you say is that 8,100 doses, we're starting with the vaccination teams to make sure that they can vaccinate.
Correct.
But that also includes the 8,100 long-term care facilities, frontline workers, hospital workers.
Well, the hospitals received vaccine themselves, right? If they need some of this vaccine, then certainly that'll be available to them. And then our healthcare workers in private practice, that 8,100, if CVS and Walgreens does not need the support to vaccinate our long-term care facilities, then we will expand to our healthcare workers in private practice. So that's when we're planning as we talk to set up points of dispensing and make appointments for healthcare workers to come in and get their vaccinations.
Give a timetable. Everyone's asking us.
Sure.
I know it's so hard to say, but.
Yeah. Well, we can give you what we plan today.
Sure.
So if we do get the vaccine tomorrow evening, we're planning to start vaccinating the vaccination teams on Wednesday. We are planning a full-scale training on Monday, the 28th, and that's all support teams, so that's including True Health, that includes Allied Health, the health department, the paramedics, and then we will vaccinate more team members then. The week of January 4th, we plan to open up pods for healthcare workers. All of that could change if we get a call that says, okay, we need your help with long-term care facilities. And if that is the case, then we will divert and make sure that those long-term care facilities are taken care of first. Does that help? Does that help? Sure.
Any other questions?
Yes, Mr. Constantine, you mentioned that those portals are going to reopen if more funding is made available. With this deal that we made in Washington, are you expecting more funding? Do you have an idea of how much? No, everything's happening.
We don't know if this particular, if you want to call it bailout proposal, is going to include local governments. If it does, then yes, we are committed. This county is committed to take care of our citizens, and it's committed to make sure that we get the resources, when we get those resources, that we get them back into the community that needs it so much. So if it comes to us, we will find a program, we will open those portals, we will find a program, the programs, fund those programs with those dollars and get them back out to the community as quickly as we can.
If it doesn't, what do you say the law is?
I'm sorry?
If it doesn't include money that will help reopen those portals, what do you say the law is?
Okay, well, the question is if that money doesn't include the local governments. First of all, again, I don't know what the agreement has been. We have seen it going back and forth. We have been begging to ensure that there's money that comes to the counties and local governments, because that is the easiest way to get it back into the people's hands. So what we're saying is, if it is not included this time, you and I both know they're going to continue to work on more opportunities. And all I can say is, if you look at the record, if you look at what's happened, if you get it back into the hands of local governments, we can get it to the people in most need quicker and more efficiently. Any other questions? Ladies and gentlemen, Merry Christmas, Happy Hanukkah, Happy New Year's, and Happy Holidays, and please, everyone, be safe. Thank you very much.
This will be the,
If y'all could remain quiet, if anyone has any questions, they can come out.
Myrna is going to give the Spanish interpretation now. I apologize, Myrna.
that's okay, thank you. Sí, este es el resumen en español de la conferencia de prensa del día de hoy. En primer lugar, habló el presidente de la Junta de Comisionados del Condado, Lee Constantin. Él, pues, por supuesto, le dio la bienvenida a todos y mencionó quiénes son las personas que iban a hablar. También habló sobre CARES. El condado de Seminole reconoció la necesidad financiera de sus residentes y negocios. Originalmente se aprobaron 9 millones para Seminole CARES y 7 millones fueron aprobados para becas de asistencia individual. Una vez que se agotaron los fondos, nuestros equipos todavía tenían miles de solicitudes para revisar. Como resultado, el condado designó dólares adicionales para estos programas de becas. En total, el condado aprobó más de 19.5 millones a más de 5,000 solicitantes de asistencia individual calificados, más que duplicar nuestra inversión inicial. Los hogares elegibles pudieron recibir hasta $5,000 en asistencia de alquiler, hipoteca y o servicios públicos, pagadas directamente a sus arrendadores, prestamistas, hipotecarios y proveedores de servicios públicos. Mientras que el portal de solicitud de becas permanece suspendido, las personas que no solicitaron pueden tener una oportunidad en una fecha posterior si fondos federales adicionales se ponen a disposición del condado. Además de las becas CARES para individuos, se proporcionaron $881,515 a los residentes que enfrentan desalojo. Este fue un esfuerzo coordinado con nuestros socios judiciales, el secretario de la Corte y la ayuda legal del Colegio de Abogados del Condado de Seminole. Los fondos SHIPS se utilizaron para financiar este esfuerzo para mantener a 340 clientes en sus hogares. Las becas CARES también regresaron a la comunidad a través de subsidios o becas sin fines de lucro. Habían agencias sin fines de lucro que repartieron una parte de 2.9 millones a medida que continuaban proporcionando servicios esenciales para nuestra comunidad. Por último, CARES Small Business Grants ayudó a mantener un funcionamiento a más de 2.600 empresas durante la pandemia. Se asignaron casi $13 millones a empresas calificadas que demostraron una pérdida. Animamos a los residentes a patrocinar nuestras pequeñas empresas. A medida que se apoya a tus vecinos a través de este esfuerzo, también devuelve dinero a nuestra economía local, apoyando empleos y apoyando a las mismas empresas que devuelven a la comunidad. Hay un listado de empresas que toman precauciones adicionales para proporcionar un entorno de compras seguras. En cuanto al COVID, a medida que se frecuentan estos negocios, no podemos enfatizar lo suficiente lo importante que es la seguridad. La orden ejecutiva del condado de Seminole para el distanciamiento social y el uso de máscaras permanece vigente. Si bien las multas y sanciones se suspenden para las personas por estado, las multas y sanciones pueden seguir siendo evaluadas para las empresas que presentan negligencia grave. El condado está buscando el cumplimiento voluntario sin emisión de multas o reportando a la agencia de licencias respectivas de una empresa. Hay mucho en las noticias sobre vacunas. El condado de Seminole está trabajando con el Estado para prepararse para la difusión de las vacunas. Y para eso, pues, la directora del Departamento de Salud del condado de Seminole, Donna Walsh, habló al respecto. Primeramente dio un resumen del COVID a nivel mundial, que hay 70 millones de casos en el mundo, 77 millones, 18 millones en los Estados Unidos y 1.2 millones en la Florida, con sobre 2,000 muertes, lamentablemente. Han habido un aumento de casos exponencialmente en las últimas semanas. Y aquí en el condado de Seminole hay 16,358 casos confirmados, una tasa de positividad de 8.57%. Ha continuado en aumento los casos de COVID. Se puede comparar que en la semana del noviembre 12 al 18 habían a la semana 642 casos y ahora de diciembre 13 al 19 hay sobre 1,000 casos. Hay muchos casos también en en la población más vulnerable, que es en los long-term care facilities o en los centros de cuidado de adultos, ¿verdad? Donde un 60.6% de todos los fallecimientos, son en esta población. Estamos todos cansados como comunidad, pero debemos mantenernos vigilantes, seguros, usar nuestras máscaras y el distanciamiento social, que es tan importante. Pero sí hay unas noticias emocionantes y es la llegada de la vacuna que todos hemos ya visto. El 11 de diciembre Pfizer fue aprobada para el uso de emergencia en cuanto a la vacuna, y también esta semana que pasó, Moderna también ya tiene su vacuna en donde la FDA aprobó el uso de emergencia. El condado de Seminole continúa coordinando en conjunto con el Estado a medida que se desarrollan los planes para vacunar a la población. Primeramente, CVS y Walgreens recibió la vacuna Pfizer para poder vacunar a los centros de cuidado a largo plazo, a la población que ya hemos mencionado que está más vulnerable. Y el condado y el Departamento de Salud también se mantienen para apoyar a esa población si así se necesita con lo que ellos han recibido. Hay grupos prioritarios para las vacunas y está dividido en diferentes grupos porque hay una cantidad limitada de vacunas. En primer lugar, 5 hospitales recibieron las vacunas a través de la Florida, uno de ellos siendo Advent Health aquí en la Florida Central, donde están vacunando a sus profesionales de la salud. También en el grupo 1A están los trabajadores de salud que prestan servicios directos, como hemos visto de los hospitales, pero también del Departamento de Salud. Los paramédicos también van a estar en este grupo, así como otros. Así que es importante que este primer grupo, los que van a dar la vacuna a la población, también ellos están en este primer grupo. La población que está más vulnerable también mencionó Dana, son aquellos 75 años o más. Así que es bien importante, ellos están ya en el grupo 1C. El grupo 1A son los primeros los trabajadores de la salud. Luego están en el grupo 1B la policía y los del 911 y los trabajadores esenciales. Y en el grupo 1C son residentes de 65 años o más. Semanalmente se continuarán recibiendo más vacunas y estamos preparados y nos hemos venido preparando tanto en la Oficina de Manejo de Emergencias como el Departamento de Salud del Condado de Seminole para poder recibir y distribuir las vacunas. Somos uno de 8 condados pilotos que están recibiendo la vacuna para poderla distribuir a través de estos grupos prioritarios. Las vacunas que se están recibiendo de Pfizer y ahora de Moderna, que llegan próximamente estas semanas, el condado de Seminole va a recibir 8.100 dosis de ellas para sus grupos que van a estar dando la vacuna en la comunidad. Es una tecnología nueva que es la mRNA. Y bueno, como toda vacuna pueden haber unos efectos secundarios. Sabemos que algunos de los efectos que vemos cuando se coloca una vacuna es enrojecimiento en el área, hinchazón en el área, quizás un poco de dolor en el brazo donde se colocó la vacuna, así como fiebre, escalofríos, cansancio, dolor de cabeza. Y en la mayoría de los casos esto es normal. En varias ocasiones puede ser que sean ¿verdad? No se ha visto mucho a través de cuando se han ya comenzado a dar las vacunas, pero en ocasiones, en raras ocasiones, se han visto quizás un efecto secundario un poquito más severo, pero de nuevo, la mayoría de las personas le han ido muy bien con la vacuna hasta el momento. Continuamos también y hemos invitado a las agencias colaboradoras que han estado con nosotros haciendo las pruebas y ahora para dar la vacuna, como lo son True Health y Allied Health. Y estamos seguros y confiados que podemos, como equipo, trabajar para dar la vacuna de manera rápida y eficaz. Recibiremos la vacuna nuevamente, que es la Moderna, y ya la población en general no recibirá la vacuna hasta más adelante, quizás ya marzo o abril del próximo año, pero de nuevo, mientras más personas se vacunen en la comunidad, mejor es. Luego, Chief Dross, el jefe del Departamento de Bomberos del Condado Seminole, habló que en coordinación con el manejo de emergencias del condado y el Departamento de Salud, los técnicos de emergencias médicas y paramédicos del Departamento de Bomberos se están preparando para las vacunas cuando lleguen al condado de Seminole. Al igual que todo lo que hacemos en el departamento, estamos planeando, entrenamos y nos preparamos para servir al condado en cualquier emergencia o crisis. Nuestros equipos de bomberos y paramédicos son una parte crítica de la infraestructura médica dentro del condado de Seminole. Y como tal, trabajaremos al lado de enfermeras y otros proveedores médicos como parte de los strike teams, que son las personas que están en un grupo para ir a dar las vacunas a las demás personas en estos grupos prioritarios. En los próximos días, los paramédicos y EMTs, o los técnicos de emergencia, recibirán capacitación específica sobre la vacuna. Y después de eso, las vacunas serán administradas al personal. La pregunta natural que nos hacemos es cuántos recibirán la vacuna. No es obligatorio, no puedo darles números exactos o porcentajes de quién elegirá recibir la vacuna. Sin embargo, hemos presentado una lista de necesidades para cubrir a todo nuestro personal crítico, mencionó el Chief Dross. Al igual que con toda la pandemia, las cosas cambiarán y el número de los que se están vacunando también cambiará. Se le puede decir que el personal de los strike teams tendrá que vacunarse para administrarla a los demás. También él mencionó que como ha pasado ya por el COVID y también presenció el impacto, y hemos todos presenciado el impacto en la comunidad, y más específicamente el número del personal de fuego y emergencias que ha sucumbido a COVID, el jefe del Departamento de Bomberos dice que será el primero en la fila para recibir la vacuna cuando se le dé la oportunidad. Una vez que los paramédicos reciban la primera dosis, estarán listos para servir en el equipo que dará la vacuna. Sé que en este punto hay más preguntas que respuestas, pero a medida que esta vacuna se lanza, nos da esperanza. Esperanza para llevar a nuestra familia, comunidad y nuestra gran nación de vuelta a un estado de normalidad. Tenga la seguridad de que las cosas evolucionarán y cambiarán. Sin embargo, confío en que nos adaptaremos y afrontaremos cualquier desafío y adversidad a medida que avancemos en esta fase de vacunación. Tenga la seguridad de que en este esfuerzo, como en todos los demás, el Departamento de Bomberos se preparó para servir a la comunidad en su mayor momento de necesidad. También él mencionó que al momento 112 personas de su personal del Departamento de Bomberos lamentablemente ha fallecido debido al COVID. Y por último, habló Janelle Dunn, que es la directora ejecutiva de True Health, que es una agencia sin fines de lucro que da servicios a aquellas personas que no tienen acceso y no tienen quizás seguro médico, y tiene 7 localidades aquí en el condado Seminole y en el condado Orange. Ella habló de cómo True Health ha estado colaborando tanto con el Departamento de Salud como manejo de emergencias para proveer las vacunas, las pruebas primeramente de COVID-19, y le pudieron ayudar a las personas que tenían barreras, ya sea de transportación y de otra índole, para recibir las pruebas del COVID, y ellos pudieron llevarle las vacunas, ¿verdad?, y hacerlas accesibles. De igual manera, pues están trabajando juntamente con todas las demás agencias para poder proveer las vacunas tanto a su personal como así a los demás cuando se les necesita. Así que en este momento el presidente de la comisión, de los comisionados, mencionó y le dio las gracias a todos por haber venido, y queremos desearle a todos una feliz Navidad y que se mantengan seguros y la pasen muy bien. Hasta la próxima información. Gracias.